Our focus today will be on the California Advanced Primary Care Initiative, or as we affectionately call it, CAPC. We are very excited today to highlight this work among commercial payers that is designed to shore up primary care in California through alignment, investment, and a standardized approach to data sharing with practices. This initiative is actually a joint effort by the California Quality Collaborative and the Integrated Healthcare Association that convenes a coalition of large commercial payers to enable primary care practices to transform to a care model that reduces costs and improves quality and equity outcomes. In short, a value-based care model. 4 commercial payers that are competitors in the state of California, which includes Aetna, Blue Shield of California, Elevance, and HealthNet, are actually collaborating through CAPC to launch a shared value-based payment model pilot. It involves many different kinds of experts in quality, in contracting, experts in practice transformation, and actuarial science, just to name a few. But most challengingly, this endeavor is crucially about building trust. And it's about building trust among stakeholders that have many years of experience working together that have not yet engendered trust. Yet we are also here because we are all believers in the potential and the power of primary care to make profound change, not just in the lives of individuals, which is really important, but in the fitness of our entire healthcare system.
And this is a multi-payer initiative, and we seek to enable change and transformation in primary care. And there are 4 main commitments to scaling advanced primary care. So first of all, transparency, and that's through measurement and public reporting. And this includes, measuring primary care spend and making sure that that information is available. Working towards primary care payment alignment and increase investment in primary care, which is really part of the payment model demonstration that will be taking place later this year. And then practice transformation driven by this increased investment. It's unique and it includes payment for direct patient care plus an additional regular payment to support population health activities and a performance-based incentive based on a standard measure set. So this will be implemented as a demonstration project starting later this year and running through 2025. It involves 4 commercial payers, and it will include up to 30 small to medium private practices in the state of California. We're initially focusing on Southern California and Central California, tested in the commercial PPO space. It's really meant to be, payer agnostic. And we're really coming together to illustrate something we already all believe. And that's if you invest more dollars into these primary care practices, quality improve, but patient and provider satisfaction will improve. We're initially testing in the commercial PPO space, but the payment model, the measurement, the common reporting platform, they can be applied to other payer spaces. And we really want to increase alignment. And in order to make lasting change for primary care practices, this needs to be, more than just the commercial space. It needs to extend to other payer types and different spaces.
The changing payment to consistently invest more into primary care and provide it upfront and flexibly gives practices the resources to sustain improvements that they would gain from a short-term TA program. So multiple plans working together to pay more and differently upfront is going to help improve operations in a sustained way so that more of their patients can be paid under the same model. We can literally help our patients more by doing this together. And also part of the payment demo that was referenced is not just providing dollars, but providing technical assistance in a shared way across all the plans to the same practices so they can get the most out of the payment model.
Blue Shield is really excited from a leadership perspective to invest in the advancement of primary care. It's been a priority for us for quite some time, but then to have the opportunity to do this work with other health plans has made the experience, as we have said, level up. And we all have decided together that primary care is the one area that we can influence not only health outcomes, but quality, member experience, access, looking at the cost of healthcare. We've got to do something different. And it all starts in that room with our primary care physicians. We recognize that, for our network providers, that they're experiencing more and more administrative burdens and being asked to do more with little. And in order to make a difference, we're going to have to invest. We're going to have to give them the resources that maybe they didn't have before. We're losing our primary care providers, and so we need to empower and invest in them. And then we want to also talk about just the benefits of just bringing us together and looking at aligning together on one set of metrics from a quality perspective. We know our providers are dealing with multiple health plans. What we're trying to do is to align and give them quality measures that are already on their radar. So to empower that physician to be able to give them not only the resources and give them the access to community resources, but also to invest in their time. And that's the difference. That's a key difference that we weren't doing before. And this is what this work will do. Our IPAs and medical groups are dealing with the same exact issues that health plans are, if not more heightened, because they've got patients right there who are complaining that they didn't get to see their doctors. They've got patients right there that need that intervention. And so if we can take the learnings that we've worked together and also mirror it alongside our IPA and medical group partners, the stronger we'll be.
Work and investing in primary care and performance improvement requires multi-payer alignment, requires people, requires process and program and strategies, and fundamentally, foundationally, requires an infrastructure, a common reporting platform that allows for the ingestion of all different data assets and different data types, from clinical data to administrative data, to lab data, to pharmacy, hospitalization, out-of-network information, and data that lives within the EHR, right? So we look at the vast ecosystem of data. How do we make sense of all of that data into information and making it actually actionable for the providers at point of care, and bringing that transparency all the way across, all the stakeholders across the continuum. So Coziva's role in this place as the common reporting platform, we bring that infrastructure, we bring that platform that allows for real-time performance measurement and tracking and management. Our platform supports all payers, all lines of business. So understanding the compliance and the non-compliance and having the true transparency and visibility of that information, then you start to build trust between the providers and the stakeholders and the payers across the ecosystem. Okay, we want to eliminate chasing data gaps, and we want to recenter and focus the conversation around investments in care, investments in outcome, and strategies for tackling the population that needs that care. For what we bring to the table is having that one common reporting platform, one digital front door for that provider, for that practice, one platform to log in to see their performance and engage in that performance and that work real time.
What was really important to everybody was the more time the health plans invest to coordinate on this together and making it as in sync as possible with a common platform, with common technical assistance, trying to streamline the contract language to be as close as possible. All those little pieces, the more coordinated it is, the better it is for the providers, and it's really achieving the main goal of what we're trying to do. So though it took more time, it's really gonna end up making this a stronger outcome.
Yeah. To have all of those arrangements be on one common reporting platform, for all of us to be in parallel and move together on this work in improving access and improving care and population health. So I think that, one of the things I think we all would like to see is how do we get IPAs and medical groups to also engage in this work
one way to grow this initiative is to invite more stakeholders to the table. So more plans, more provider groups, more IPAs. And it would also be through, implementing this to practices. We're always keeping that voice of, that small, independent primary care practice, physician and care team in our minds, and making sure that we're really creating something that they want to be involved in. And so inviting more stakeholders to the table, but making sure that when they come there, we're listening, and we're making sure that we take their voice into consideration and we're translating it into our program. We are reviewing the different components and pieces of the payment model and how the measure set will be administered, and making sure that we are aligning on the same core structure for the most important pieces and how it's delivered to the practices. The population health, management fee is meant to be a regular, predictable payment. And we don't want to be too prescriptive about how the primary care practices, have to spend this money. Which is why we've, created this wonderful technical assistance program where the coaches will work one-on-one with these practices to really figure out what is the right area to invest in, or areas. And that could be, more team-based care. It could be focusing on access and, using that payment to invest in those things that, under fee for service, you're not necessarily able to bill for, whether it's phone calls, messages through your patient portal app, it could be a variety of things, and just not being too prescriptive, and just making sure there's flexibility, because really these primary care practices and the coaches are going to know best how to use those funds.
We would love to see more alignment from payers, but ways that payers can align that'll positively impact Medi-Cal patients also is something that we would like to see. It's not directly focused on Medicare right now, but most of these providers are seeing Medicare patients also. We're in recruitment, so we would love potential practices or provider orgs where there's overlap with the plans to potentially get involved. We would love for interested parties to get involved.
That idea that we can put discretion back into the hands of the physicians and the clinicians and the teams that they work together with, that to let them do the right thing for the patient based on their knowledge, based on their experience, based on the evidence in the medical literature. And you heard the call to action. Join us and think of your friends who can join us to push this work forward.